It marks exactly 90 days since President Biden ordered U.S. intelligence agencies to report back to him on the origins of COVID-19. He expected to be briefed today with an unclassified report for the public anticipated in the coming days. Meanwhile, a 77-year-old woman who died of COVID aboard a Carnival cruise, believed to be the first cruise ship COVID death since cruises resumed here in the U.S. earlier this summer. And parents across Florida in court today taking on Governor Ron DeSantis over whether he has the authority to decide who wears a mask in schools. And rising case numbers forcing schools across the country to return to virtual learning, cities and states to reimpose mask mandates and capacity restrictions, and hospitals back into overdrive as the amount of available ICU beds shrinks. NewsNation correspondent Marky Martin live tonight in Texas. So Marky, we know Texas is being impacted right now, but what's the outlook nationwide?
Yeah, Nicole, right off the top here, want to show you this interactive map shared by Johns Hopkins this morning. This is a map of the whole country, and it shows you where the outbreaks are. Now, if you pay attention to those orange spheres, especially there along the bottom, you see that the outbreaks are really, most largely happening in Texas, California, Arizona, Florida. In the past 24 hours, the United States has seen 230,000 new cases of COVID, just north of 900 deaths. Of course, this is pushing hospitals back to the brink. The pressure is on once again. Here in Texas, for example, just last week, 89 of our hospital systems came forward to report that they had 0 ICU beds available. 0. Cities like Austin, doctors and nurses having to treat patients in the waiting room. One nurse even coming forward and saying, this is like we're at war. Taking you to Houston now, 3 emergency rooms there are now closing because of this COVID-19 surge. And that hospital is Memorial Hermann, and Memorial Hermann releasing a statement saying that by doing so, we can really reassign those staff members to other areas of the hospital that need more critical care. Also in Houston today, not a hospital setting, but the NRA canceling its annual national conference that they hold in Houston because of the latest numbers. And lastly, Nicole, want to take you out to West Texas, to a very small, this is an oil field town named Ira Ann, about an hour, 15 minutes south of Midland, Odessa. A population of 1,200, and there's a 42% positivity rate. This has closed down schools for 2 weeks. It's shut down businesses. And Nicole, these are stories just out of Texas.
Yeah, just out of Texas. So, of course, we tossed to you talking about the pressure on hospital. And we know hospitals, we know some states now calling in the National Guard for help.
Yeah, exactly right. Let's just take a look at this week, Nicole. Yesterday, the governor of Kentucky coming forward and calling on his National Guard troops to come forward and assist hospitals that are closing in on what's called modified disaster mode. And then today, the governor of Georgia coming forward asking the very same of his men and women there. In Georgia, there will be 105 personnel deployed to 105 different hospital systems across the state. And, with these new cases, these new hospitalizations, even these new deaths, so many doctors coming forward saying most of these new cases are happening in the unvaccinated. And just this afternoon, the U.S. Surgeon General, Dr. Vivek Murthy, coming forward practically begging Americans to roll up their sleeves.
Please do it. Please get vaccinated. Do it for your own health. Do it for our children who are unable to get vaccinated and rely on the rest of us to shield them from infection. Do it for our healthcare workers who are running on fumes.
Yeah, running on fumes. Nicole, this is the plea being heard around the world right now as healthcare workers are working in overflowing hospitals now for the 4th time during this pandemic. Nicole.
Yeah, we hate to see these case numbers going in the wrong direction. Marky, thank you.